Today is a national day of joy, witnessing the launching of the testing for COVID-19 in the Gambia at the national level by our National Public Health Laboratory services. When COVID-19 came, we were at a stage when we could not respond because COVID-19 testing actually calls for the highest level of laboratory services. And we were, I would say, not at the middle, but way below the middle of our capabilities to provide laboratory services in this country.
So far, 6 staff members have received training on the testing, and 53 other staff members have received training on sample collection. Recognizing the need for the NPHL to also conduct the testing at the National Reference Laboratories, the Ministry of Health engaged the MRCG Gambia to provide support to the NPHL and establish the testing platform for COVID-19 at Kotu. The National Public Health Laboratory is now ready to conduct independent testing of samples of COVID-19, and that has already started, as you have all seen.
Since February 15, 2020, our unit has invested more than $2.3 million to conduct more than 2,000 tests in our laboratories in Fajara. These tests were done in collaboration with staff from the National Public Health Laboratory, who were part of the trainings led by our laboratory team in Fajara. In addition, we have spent an estimated $6.5 million to stock up on reagents for laboratories. Over the past few months, we have supported the efforts to prepare the National Public Health Laboratory to start COVID-19 testing. Our teams have led comprehensive training for the National Public Health Laboratory staff to this effect. Through this collaboration, we have loaned 1 real-time PCR machine, 2 PCR workstations, and other minor laboratory equipment to the national laboratories. We have also undertaken the calibration and certification of pipettes and safety cabinets in this laboratory, because the most important thing here is also the safety of the staff, because this is a very infection agent and we need to protect the staff doing the test appropriately.
So when the opportunity came for us to at least be able to decentralize testing where we're doing the MRC to get it here, I worked really very closely with Aruna to actually firstly set up a report, really meet with the minister himself, and then the minister actually sent a request for us to actually go through the process to get people trained and people to be able to do independent testing at the National Public Health Lab.
I am very honored to be part of the testing and collection team, and very glad that the National Public Health Labs is trying and really advancing in making sure the testing is done by themselves and by Gambians.
Part of the work I'm doing is not just stop at getting the lab ready, it's actually making sure that they're independent scientists. I'm mentoring Aruna Jallo, who is one of the senior biologists here. So we want to make them to be able to do research, to be able to do not just COVID testing, but other pathogens that we have in Gambia as a National Public Health.
I've been very fortunate to be trained by the MRC on how to work with the COVID-19 samples, with the processes, all the biosafety regulations and everything. As a team, we've undergone so many trainings on corona sample testing so that we've become more competent in how to handle it and process it.
We were very lucky, very fortunate that when the COVID-19 pandemic started, the MRC Gambia was able to do the test. These samples would have been sent to Senegal for testing. So we are very happy that they've been able to do the test.
In anticipation of a potential need for more COVID-19 diagnostic services, as the pandemic develops, we have invested about $3.3 million on minor equipment to prepare our Canada Embassy laboratory for testing. This will support the Ministry of Health plans to ensure testing is also available in the regions, contributing to shorter turnaround times from sample collection to the production of results. I also take this opportunity to present a donation of materials worth more than $1.5 million to the Ministry of Health. This donation is part of our ongoing support to the government of the Gambia through the Ministry of Health as the country responds to the global COVID-19 pandemic. These are very trying times for countries all over the world. It is therefore important for us all to collaborate and work effectively to save lives and beat the pandemic in the Gambia.
The MRC Gambia has been a true partner to the people of this country and the Ministry of Health. In fact, MRC Gambia is actually a Gambian institution. Most of the funds come from elsewhere, but the institution is here and it's a Gambian institution. The services they provide is for Gambians. In the process, other people elsewhere in the world also benefit.